Good afternoon, and thank you for joining us again today. I want to start out with our moment of gratitude for our families and support systems, for our team here at KCHD and throughout the community that are allowing us to be at work and respond to this COVID outbreak with many hours. And so we're very appreciative of the support they provide us and keeping our kids, cooking dinner, doing the laundry, whatever it is they're doing to keep us working. So thank you. We're constantly wanting to provide more and ongoing information to our community. To that end, we have heard your desires to move back to regular 5-day-a-week briefings. Beginning today, we are moving back to that format. Today, we want to begin also by talking about the reopening of our community. We all know that Governor Lee is not renewing his stay-at-home order. And we look forward to reviewing the full guidance that will come out from the state's economic recovery group and working with local leadership and our community to implement a phased, data-supported local plan. Regarding the local data, we have been able to increase testing, and we're really happy we've been able to do that. However, the demand to date has actually exceeded our supplies. Securing additional testing kits and PPE continues to be a priority for us as we further develop an expanded and strategic testing model to test as many people in our community as we can. And on that point, we are looking for testing supplies every day. We're either looking to see if we got some in, or looking to see if there's another source for us to get those supplies through. So our staff is every day looking for more supplies so that we can offer testing to those who need it in our community. But we also encourage private providers to expand their testing capacity so that they can better serve our community and their patients. The Medical Surge and Alternative Care Task Force has done an excellent job in their preparedness and planning efforts to identify expanded hospital capacity should it be necessary. So our hospitals are planning together on how to address any potential surge that we might have. So I think that's important for the community to know. It's not one hospital and another hospital doing something different. They're planning together. And it's unique, and we appreciate that. We continue to expand our contact tracing efforts, and are prepared to further scale them up as needed by increasing the size of our team. So as you can imagine, that takes a lot more people when we return to somewhat normal activity. We'll see that probably need to do more contact tracing. So we have plans to expand that team. Fortunately, we have not seen a spike in cases, due in large part to what you're doing, what our local businesses are doing to safeguard the health of our community. And I can't say enough about how important the role of the community is in reducing the cases of COVID-19 here in Knox County and throughout East Tennessee. So keep in mind, you're a key to how this goes when we do start reopening. And we continue to explore additional metrics that will help us evaluate the burden of disease within Knox County, not just looking at testing alone. Our local data does support a thoughtful and phased reopening. More details are forthcoming regarding Knox County's phased plan, but in the meantime, it's important that everyone understands reopening is not a return to pre-pandemic levels of activity and closeness, physical closeness. Social distancing, wearing a mask, washing your hands, staying home if you're sick, all of those things will continue to be very important for months to come. We will continue to need to safeguard the health of our community by doing those simple things. As businesses reopen, we'll hope to be able to provide them guidelines so that they can safely do that for their employees and for their customers, because we know nobody wants to contribute to increases in cases in our community. So throughout the phases of our plan, we must pace the business openings, maintain social distancing, wear masks, and follow infection control guidelines, and advance innovative ways to reduce risk of transmission. Businesses have already come up with some new ways to do that, and we look forward to more of those. Several stakeholders, the business community, our state and local leadership, are involved in the development of our plan. Key stakeholders, are creating recommendations on how the community can provide feedback during the process. The primary reason we need feedback from our community is because the success of reopening is the responsibility of all of us working together. Public health, employers, employees, government, healthcare, and the public must work together to ensure we can reopen our economy and protect our health all at the same time. Now we'll move on to the local situation. We have 195 confirmed cases of COVID-19 in Knox County. 165 of those have recovered. 27 have been hospitalized at some point during their illness. And again, we are grateful to report we do not have any additional deaths in Knox County at this time. As we mentioned yesterday and even previously today, the volume of our drive-through testing far exceeded our expectations. Because testing supplies are not unlimited, we are making some adjustments to our testing schedule. We are suspending testing for tomorrow and moving back to appointments this Thursday and Friday using a drive-through model. Appointments can be made by calling the public information line at 865-215-5555. Appointments will be used to prioritize folks who either are high risk because they're a contact to a case or they have symptoms in that expanded symptom list of fever, cough, shortness of breath, chills, headache, and a new loss of taste or smell, which is kind of an interesting symptom that some people are seeing in COVID. Our goal is not to turn anybody away, but our goal is to prioritize those folks who need to be tested. And one thing we've noticed is some people have been tested recently and they get tested again. We don't always have a way to see that. So if you've been tested recently, no need to get tested again too soon unless something's changed, like your symptoms have changed. We are also exploring a drive-through event for this Saturday in an area of our community where the public has less access to testing. We're following the weather forecast closely and will announce finalized plans as soon as we can. Appointments will not be necessary for that event. We are continuously working to obtain additional testing supplies, as I said, and we'll continue to evaluate and keep you appraised of any changes in our testing schedule moving forward. And now I'll open it up for questions.
All right, first question is from WBIR. They say our viewers are asking, why did the governor decide to open on May 1st when our curve is not flattening and our cases keep going up?
So the rate of increase of our cases has slowed. Actually, here in Knox County, it's slowed a little bit. It's never been terribly high. But when we look across our state in places like Nashville and Memphis, what we've seen is the rate of increase of cases has slowed down. And that's what flattening the curve is about. It's not about no new cases. It's about slowing down the rate of increase of cases. In Knox County, our rate of increase has stayed pretty steady. And we haven't seen a big spike. So again, what we've seen across the state, looking specifically, probably primarily at Nashville and Memphis, is that they have seen a slow down in the number of new cases they're having. So to the point that the governor and the commissioner of health felt comfortable making this recommendation. And I think the other thing to remember is that closing businesses down is not a long-term solution to this outbreak. We need it. We have to go back to work. We have to go back to business at some point. Doing it in a phased fashion will improve safety and reduce the risk of more people becoming ill.
From WVLT, House Democrats have just had a news conference in Nashville saying the governor is putting the lives of our citizens at risk by opening the state too soon. If our local political and health departments disagree with the governor, will we keep the safe at home ordinance in place?
So what we've decided locally, the county, we've decided is to follow the guidance from the governor and to do a slow phased data-based reopening, giving guidance to businesses and to the public on how to keep themselves safe, and keeping a watch on different metrics that will indicate increases in level of disease. Looking at possibly monitoring COVID similar to how we monitor flu during the winter every year. So we're not making a new system looking at just a different illness in that same way.
From the Compass, you have said expanded testing and increasing social and business interactions will increase the number of positive test results. At what point would an increase in cases cause you to either temporarily halt the economic rollout or return to the current restrictions?
It's a great question. And I think it's going to be based on, it's going to have to be based on the data and the situation. I think we have to look at all the pieces of what are the connections, what are the lack of connections between those cases, and what that really looks like at the time. So that's a question we can't answer until we get there. I know that's not always satisfactory, but we really have to use the data to guide us.
From WATE, what is Knox County's plan for reopening? Other communities have specific phases for opening specific categories of business. What would that look like here?
Well, you've seen what the mayor put out, and we also have a team, a local team who's working to take that and kind of operationalize it. It's kind of some broad strokes and suggestions and ideas. And then we'll also use what comes from the state to also tweak that plan as well, and it will be coming shortly after that.
Their follow-up was, can you give us any specific precautions tailored to individual industries? How would precautions compare at gyms, retail, restaurants, salons, and elective procedures at medical facilities?
Again, those are great questions. And our local plan is being created and developed. And we actually have a plan to try to get some input from industries as we roll things out. It will be very slow and phased. One thing I can tell you is for everybody, we're going to continue to recommend social distancing. We're going to continue to recommend frequent hand washing, recommending that employers really enforce their sick leave policies and not let sick employees work. And that the public, if you're sick, don't go shopping, get somebody else to go shopping for you, and keeping that social distancing 6 feet apart, limiting the number of people in the store. All of those things are going to stay in place.
From WBIR, are we going to spike it right back up again by everyone shopping and going out? What's different now? The testing?
I think what's different, well, I want to remind everybody this is not back to pre-pandemic. Everybody just go do what you want to do. We're still going to advise people to be thoughtful about their trips, to wear a mask, to wash their hands, to stay home if they're sick, to practice social distancing. All of those things are going to stay in place. And I really appreciate, we know that people can do that. And we really appreciate people being thoughtful and doing those things. And we want to create an environment that's safe for people to go back to and purchase the things they need to purchase. But again, being thoughtful about that. And I think the big difference is that we've had a time period where our cases have really not increased greatly, and they've kind of stayed steady. They're increasing, but they're staying steady. And again, closing things down was not a long-term solution, and we have to at some point go back to business.
From WBIR, will the county health department consider extending the stay-at-home order for Knox County?
I think we've answered that question. The health department's order expired already. We don't plan on renewing that. Again, we plan to follow the state's guidance.
From WBIR, is it true that the final decision to reopen or to reinstitute a countywide order rests with Dr. Buchanan?
Well, the truth is that in my job as the public health officer, I'm actually an employee of the county, and decisions about this outbreak and other outbreaks are made in concert with the mayor's office. I serve in an advisory role to the mayor. And I think that another really significant difference between this and other outbreaks that we have, this is huge. This is involving the entire world, the entire community, the entire state. This is not an outbreak that's happening in a bubble. It's not one restaurant that made some people sick. It's not one cow share that made people sick. It's a worldwide event. And we cannot make those decisions in a bubble and again, serve as an advisory capacity, because this is impacting all across our community, not just an isolated group of people.
From the Sentinel, what are some of the specific measures Knox County used to determine how things will begin reopening, and what data will be used to determine that?
So we're looking at lots and lots of different sources. There are several different things being published right now with data to support that on how to safely reopen a community. And so we're coming through that information. We'll use those same data points to determine how things are going here in Knox County.
WBR has asked, is it safe to reopen? Will more people get sick because we are reopening?
I think the reality is we will see some increase in cases. People getting out and mingling a little bit more is going to cause a slight increase in cases. We'll have to keep an eye on that. But again, I go back to the fact that we're going to have lots of things in place and support for the community and for businesses on how to do this safely.
Also from WBIR, if Knox County does wait longer, are there worries about potential spikes in cases in surrounding counties creating issues in Knox?
Well, I mean, Knox County is not going to wait longer. So we may see increased cases in counties surrounding Knox County. That's certainly possible. But again, that gets back to where it's important for all of us in public health to be doing our contact tracing and isolating. Anybody who's diagnosed with COVID-19 needs to stay home and not go out. Folks who are in quarantine need to stay home and not go out. A lot of this rests on the community. There's a lot of work for public health to do. There's a lot of work for businesses and government to do, but a lot of this rests on the community. So if we want to keep our community safe, keep our cases down, everybody has to do their part. And that includes people that have COVID-19.
From the Compass, is KCHD coordinating with the major metros economic restart task force? Will the task force recommendations be incorporated into the county's plans?
We are coordinating with that. All the state level task force that are working. There's so many task force working on reopening. That doesn't preclude us from planning locally and looking at our local situation. So hopefully we'll be able to roll all those different plans into what it looks like on the ground. You're going to have the high level state plan and then a more specific local plan.
Their follow-up question is, what happens if the task force recommendations are at odds with the county's plans?
Well, the county's plans haven't been written yet. So again, the plan is to have those be coordinated and look similar.
Also from the Compass, you said KCHD would look at other metrics in addition to positive case counts. What are those metrics and what is the importance of each of them?
Sure. So during flu season every year, we look at rates of what we call influenza-like illness. And that helps us determine how many people are going to see their doctor for symptoms that are like the flu. They may or may not get tested, but they're symptoms like the flu. So we have the ability, the State Department of Health has set it up so that we can see that information, and using COVID-like illness or whatever we decide to call it, to see how many people are going to see their doctor for something that looks like COVID-19. They may or may not get tested. And then we also look obviously at testing and at positive case rates. We look at hospitalizations. That helps us determine the severity of illness, in addition to the burden of disease, the severity of the disease that's in the community. And finally, we also look at deaths. It's a piece of any illness that we have to look at. So we look at deaths again, that's more of an indicator of severity of disease, but it also helps us see the burden of disease.
From WBIR, Governor Lee made it clear Knox County has more autonomy on how it'll start opening back up. What kinds of conversations are you all having about that? What's your preference? And should most Knox County businesses start reopening by May 1st?
So, like I said, there are lots of task force and lots of conversations going on about reopening. And I know that conversations between the local government and state government are happening all the time, not all the time, but a lot. So, we've looked at it locally and just made that decision that we will follow the state's plan. We certainly do have the autonomy to do something different, but at this time we've decided to go along with the state and follow the plans that they lay out. We believe that helps all of our citizens, not just in Knox County, but in the surrounding counties, see that our government's working together and feel a little more comfortable about the plan that we're moving forward with.
What advice can you offer our viewers who express they are scared to return to work next week?
It's understandable. COVID-19 is a concerning illness and continues to be transmitted in our community. And what I think people need to do is think about their own personal preference and how comfortable they are going out. Reopening is going to be phased. It's going to be slow. People are going to have guidance. We're going to provide guidance for the public. The guidance for the public is not going to change all that much, except make a few more of those trips that you're not making now, but you're still going to need to stay home if you're sick and wear a mask when you're out, wash your hands frequently, and do all of those things. We're going to still encourage social distancing. So we want to help create that environment where it's safe for people to go back into the workplace. We're also working with employers to make sure they can enforce their sick leave policies. And people don't have to stop working from home right away. The reality is if it's working for the employer and the employees, continuing to work from home can happen as long as they want it to. In addition, I think the other thing that's going to impact whether people can go back to work and not have to be at home is that schools won't be open. And so we know that parents will have to be home with their children. And so again, it's going to look different. It's not going to look like pre-pandemic. And again, we're going to work really hard to educate the public and the employers and the businesses to do the right things and keep themselves and the public safe.
From WATE, who was on the team working to operationalize Knox County's plan?
Yeah, so it's made up of some city representation and county representation and some representation from the mayor, the chamber as well. And then, that's going to roll up to both county and city mayors. And so it's a bunch of people looking at that plan and lots of input from groups that have a stake in what that plan looks like.
From the Sentinel, how many people do you have on your contact tracing team and how many do you anticipate you need?
Right now I think I have 20 to 30 right now, or maybe, okay, I'm being told higher. So 30 to 40 people that are kind of working in shifts and in teams. We have plans to activate some of the county employees that were furloughed, to bring them back to help, to scale that up as large as we need it. Certainly there are other resources we can reach out to. We haven't even exhausted those resources. So I feel comfortable that we can expand up as large as we need it to be. How big that needs to be, I don't have a definite number yet. But the system we've created works, so we know how big those teams need to be. So each time we'll just add a full team and keep going from there.
Another question from the Sentinel, how many tests have been done in the county in total?
Again, that's a question we don't have an answer for. Testing is done by private providers, by hospitals, by public health. And so all those different entities are doing tests. Private providers and labs and hospitals and labs do not traditionally send just how many tests they've done for any reportable disease to public health. So being able to track that, there's no system in place and there's no process in place for them to say, we performed, X number of tests this week. So during this pandemic, during this emergency, public health did make some asks, but that process wasn't in place. It hasn't been fully developed. So it's inconsistent when it happens. So we don't have that information.
WBIR is asking for a clarification on the positive cases in Katy. It is 196. That's currently represented on our website as of 11 a.m. this morning. From WATE, Governor Lee mentioned that while his order ends on the 30th, some businesses could reopen as soon as the 27th and parks open this Friday. When is the earliest non-essential businesses could resume here?
That's a great question. That'll be made in conjunction with the planning team and the mayors as we finalize our plan.
Also from WATE, would that plan be enforced in the same way current restrictions have been enforced? How do we avoid a free-for-all once the openings begin?
Right. So as we write this plan and think about how we enforce this plan, most enforcement right now has really been about educating and raising awareness. I think we'll continue that model. I think we'll probably have to expand the people that are doing that. We have plans for that as well. So it's kind of a combination of education and outreach and encouragement for people to do the right thing.
From WATE, what metrics would be followed in moving from one phase to the next?
Right. So again, we're looking at lots of different resources. Some of the things I previously talked about, looking at, people going to the doctor for COVID-like illness, hospitalizations, deaths, positive case rates, all of those things will be part of that. Won't be the only thing we look at. And I think we have to look at, how much that's increasing or not, and phase it in that way. A lot of unknowns with this, and I know that's challenging for folks, but I want to reiterate that we plan to do a slow, phased reopening to really increase the safety of our community.
From WATE, could the county reopening plan conflict with the city reopening plan? Which one would take precedence?
Right now, our plan is to have one reopening plan. The city is part of the team that's writing the plan for the county. So it's a city-county plan. And we're encouraged by that. I think it simplifies things for our citizens and for those doing enforcement as well.
Final question from WATE, could churches resume normal services this weekend?
Not at this time. The plan, again, has not been finalized. We don't have guidance for churches on how they might reopen. So at this time, there's no plan for churches to reopen this weekend.
All right, if there are no further questions. Okay, thank you all. And like we mentioned at the beginning, we are resuming daily media briefings Monday through Friday. So we will see you tomorrow at 12:30.